Welcome to another episode of Ask Your Pediatrician. I'm Dr. Paul. The topic for today is the GAPS diet. GAPS stands for Gut-Associated Psychology Syndrome, a term coined by Dr. Campbell-McBride. And in her book, GAPS, she brilliantly outlines the huge issue we have with what's going on with our gut and what's going on with our brain. You know, folks, we are in the middle of one of the worst increasing epidemics of things like autism, ADD, ADHD, dyslexia, learning disabilities, language problems, allergies, eczema, asthma, autoimmune problems, diabetes, you name it, and a lot of psychiatric and psychological things like depression and anxiety and bipolar. Have you heard of any of those things, or have any of these things affected you or your family? Of course they have, and these things were not that prevalent 30, 40 years ago. What's going on? Well, what we have going on, folks, is you've got to think of your gut, and I'm talking from stomach to intestines to colon, as the foundation for health. These are the roots of the tree, and if there's a problem in the gut, your immune system, the GALT immune system, gut-associated lymphoid tissue, sits right below the gut. And this represents anywhere from 60-70% of your immune system. And hence, if there's a problem in the gut, there's a problem in your immune system, and toxins in the gut get into the bloodstream and affect brain and development. That's in a short nutshell. But realize this: if you took the finger-like projections in the villi, the lining of your small intestine, and splayed them all out, you have a surface area for an adult the size of a tennis court. Thinking, really? So my skin is the barrier for toxins that are coming from the outside world into my body. That's one major barrier. The other, though, that we tend to forget is that barrier from the intestines, right? Because we're constantly putting things in our mouths, eating food, toxins as well as nutrients. And that lining, the size of a tennis court, has to make that distinction between friend and foe, and interact with the immune system in such a way that we attack the foes and we leave the friends alone. Adults have anywhere from 2 to 5 pounds, we're talking 2 kilos of bacteria in their intestinal tract. And they play a huge role, not just in protecting that tennis court, as you might call it, of surface area, but also in the production of key vitamins. People don't realize that your vitamin K2, so essential for the transport of calcium and magnesium, and how vitamin D works, for all of that to work properly. And many of the B vitamins, B1, 2, 6, and 12, are actually manufactured by bacteria in your gut. Without these, we have terrible neurological problems. So this is critical, that we develop a healthy gut. What was ingenious that I read in this book, GAPS, by Dr. Campbell-McBride, and I highly recommend it, was pointing out the fact that, you know, when you're born and you're sitting in your mom's uterus, that's a sterile environment. And at birth, you pass through the vagina, if it's a normal vaginal delivery, and you're exposed to just numerous organisms, correct? Bacteria in particular. And that's your first huge hit of bacteria. Within hours, and certainly within days, you populate the intestinal tract with organisms, so many. I mean, we have essential organisms like bifidobacteria, lactobacillus, propionobacteria. These are essential and need to be in your gut, but there's also a lot of normal bacteria like E. coli, peptostreptococci, enterococci. It's like it's a jungle down there, but think of the ecology, that pond. We need to have a healthy balance there, and when there isn't, you're going to have health challenges. Problems with absorption, problems with nutrient deficiencies, problems with food intolerances, and then immune dysfunction is huge. So getting your foundation, getting your gut healthy is probably the most important thing you can do. You want to start while you're pregnant, or even before you're pregnant, developing good gut flora. This is done by taking natural organic foods, home fermented foods, and taking probiotics in this day and age that are the appropriate good bacteria. So you're developing a great ecology, a good foundation for a healthy tree, which is your health. So please, please, please pay attention to this topic. We can no longer tolerate to eat pesticides, to eat organically modified foods, GMO foods. They are destroying our gut. and inducing probably almost every single health problem we face today. So this is the book that I highly recommend you get, because the diet is fairly simple, but instituting this diet, in particular if you have a child who might have autism or a child with inflammatory bowel issues or gut issues, Dr. Campbell-McBride does a wonderful job of taking you through step by step how you might want to introduce this diet. The diet basically is as follows. For your carbohydrates, you're going to eat simple sugars only. We're talking glucose, which would come from honey. I would get organic natural honey, period. Ripe fruit, which will give you fructose, and natural yogurts, which will give you galactose. These are your simple sugars. You cut out all starches, you cut out all grains, you cut out all table sugar, high fructose corn syrup, all those other sweeteners. Your protein basically comes from free range meat, eggs, fish. You want to stew it or poach it so that it's very easy to digest, and you want only natural fats. We're talking home fermented dairy, if you can tolerate dairy, organic butter, extra virgin olive oil, cold pressed olive oil, and avocado. You absolutely do not eat any processed foods. You cut out this. For children, this is going to be a little tough, but you got to cut out those breakfast cereals and those crackers, chips, and cookies. That's all processed. It's garbage for your gut. Remember, gut is brain. And don't microwave your food. Avoid plastics. Never microwave in plastics. You can go to www.gaps.me or www.scdiet.org, scdiet.org. A couple websites where you can get a lot more information, recipes, and get a jump start on your health with the GAPS diet. But obviously, this is not a small task. This is a big undertaking. But if you suffer from major health challenges, if your child is suffering from major health challenges, and you've got it in you to take on a task that really might make a huge difference, this one's worth a try. Thank you for watching. I'm Dr. Paul.